Good morning, everyone. Today's topic for presentation is clinical features of gingivitis. Gingivitis is a form of periodontal disease which is caused by inflammatory reactions. So, immune inflammatory reactions to microbial plaque are the predominant features of gingivitis and periodontitis. The inflammatory reaction is visible both microscopically as well as clinically in the affected periodontium and represent the host response to plaque microbiota and its products. The clinical signs of inflammation in gingival tissues reflect the classical signs of inflammation: rubor, tumor, calor, and dolor. So, rubor represents redness, tumor represents swelling, calor represents warmth, and dolor represents the pain. So, to understand about gingival inflammation or gingivitis, we need to know the normal features of gingiva. When it comes to the parts of gingiva and the tooth structures, so we have something called the marginal gingiva, interdental gingiva, and attached gingiva, and there is mucogingival junction and alveolar mucosa, and there is something called contact point. Below the contact point there is a space which is called as an embrasure. So why this particular thing is important is because that's where the gingivitis is going to start appearing. And coming to health of periodontium or gingival health is represented by pinkish gingival color, as pale pink color, or is also known as coral pink color. And in Indians there is something called melanin pigmentation which superimposes and makes it little more dark. And the other classical sign of healthy gingiva is the marginal gingiva is knife edged, a knife edged marginal gingiva and interdental papillae, and there is something called scalloping all around the tooth in the margins of the gingiva, and there is something called the stippling which appears, which is the representation of which represents the retipex, the projections, and which forms the indentations over the surface of gingiva representing stippling. And coming to gingivitis, gingivitis is the presence of gingival inflammation without loss of connective tissue attachment, and which is a non-destructive disease and that occurs around the teeth. And coming to classification of gingivitis, based on etiology, it is classified into plaque induced and non-plaque induced. Based on course and duration of the disease, it can be classified as acute, subacute, recurrent, and chronic. And based on anatomical structures involved in gingiva, it is classified into marginal, papillary, and diffuse gingivitis. And based on the distribution, it is also named as localized and generalized. So, coming to gingivitis, which is caused by microorganisms. That is based on the etiology, this plaque is identified as a primary etiological factor for periodontal disease, and gingivitis is caused by multiple bacterial species and not one single bacterial species. The initiation of inflammation of gingiva, gingival inflammation results from an interplay between bacteria present and the local environment and the host response. Hence, the take is one must mechanically disrupt the biofilm to contain the disease process from advancement. Approximately 400 microbial species can live in the mouth of a normal individual, uh, and typically they find about 150 species in any one individual's mouth, and approximately 108 species of bacteria in deeper pockets. And plaque has a biofilm contributes for microbial community which is associated with a tooth surface or other hard and non-shedding materials. And the nutrients penetrate the bacteria in deeper layers by diffusion, and deeper layers are very anaerobic. And nature of biofilms which are present causing gingivitis, they form on all surfaces which are immersed in natural aqueous environments, and forms particularly in flow systems where there is a regular nutrient supply, and biofilms protect bacteria, and biofilms must be disrupted mechanically to contain the disease. So we have something called early colonizers and late colonizers. Early colonizers between 0 to 2 days. So gram positive facultative cocci, which mainly involves streptococci, forms on the surface, and 2 to 7 days it becomes gram negative anaerobic cocci, Valnella species, and gram positive rods, Actinomyces species, and gram negative rods, that is Capnocytophagus species. And above 7 days, it becomes more of anaerobic species like Fusobacterium and Prevotella intermedia. So late colonizers are more of Prevotella intermedia, Porphyromonas gingivalis, and spirochetes, motile gram negative rods. So based on uh, course and duration of the occurrence, the gingivitis may be classified into acute gingivitis. So acute gingivitis, what are the features of acute gingivitis? It is a sudden onset and short duration of time and painful lesion. The example for acute gingivitis is acute necrotizing ulcerative gingivitis. And there is something called subacute form of gingivitis, which is less severe form of acute gingivitis. Recurrent gingivitis, it appears and disappears spontaneously. That's why it's called as recurrent gingivitis. There is something called chronic gingivitis, which is the most abundantly seen gingivitis in the community, and very often seen by you people also in the clinics. And it is uh, a slow onset in nature, and longer duration time it can be present, and painless. So the acute and chronic differences are sudden onset. Acute is sudden onset, chronic is slow onset. Acute is short duration, say about 14 days to 21 days, and longer duration is chronic. And acute is painful and chronic is painless. So regarding the features, individual features, that is why the redness occurs, why the difference in the color, all this will be taught in the next lecture. Based on anatomical parts, involvement of anatomical parts, so we have something called papillary gingivitis. So papillary gingivitis is nothing but the gingivitis which is confined to the papillae, interdental papillae, and which is one of the earliest signs of gingivitis, which often occurs in papillae. And marginal gingivitis, which is involving the margins of the gingiva. Diffuse gingivitis is something where all the parts are involved, that is papillary, marginal, and attached gingiva is involved. It is called as a diffused type of gingivitis. So in this picture you can appreciate the localized marginal gingivitis, and the second picture shows diffused localized gingivitis. Based on distribution of the disease, we have something called localized to one particular area and generalized gingivitis. Localized gingivitis, localizing itself to marginal gingiva, is diagnosed as localized marginal gingivitis. In the second picture, you can appreciate the generalized marginal gingivitis because the margins of gingiva is inflamed in all the teeth. And the next picture shows localized diffuse gingivitis and localized generalized diffuse gingivitis. So it can be localized diffused gingivitis, it can be generalized diffuse gingivitis involving the all the three parts of gingiva in localized or generalized. Coming to the pathogenesis of gingivitis, we have something called the microorganisms, which are the primary etiological factors. They attach to the tooth surface or gingival sulcus, and the organisms they synthesize destructive enzymes like collagenase, hyaluronidase, proteases, and endotoxins, which are virulent factors released by the microbiota, which damage the epithelial and connective tissue cells and also intercellular constituents. And they cause widening of spaces between junctional epithelial cells, which permits the injurious agents to pass through these spaces from bacteria or bacteria themselves to gain access to the connective tissue, activating monocytes and macrophages to produce vasoconstrictor substances, making alterations, changes in the gingiva, causing redness, swelling, shiny gingiva. And the features of gingivitis involves uh, the redness of gingiva, that is erythematous and swollen, edema, shiny, soft, uh, bleeds on probing, and sulcus depth is increased, and increased crevicular fluid flow, which is uh, commonly seen in gingivitis. In the next picture, you can appreciate the marginal gingivitis all around the teeth, that is generalized marginal gingivitis. And you can, second picture shows bleeding on probing. So bleeding on probing is assessed normally with a uh, restricted the pressure, that is about 20 pounds of pressure is used with a periodontal probe, and if the surface bleeds, it is considered as bleeding on probing. And this type of disease, that is gingivitis, do not uh, cause breakdown of periodontal ligament fibers, and there won't be any bone destruction seen in the radiographs. So the final take is gingivitis is often associated with presence of dental plaque. Clinical signs are present within about 4 to 5 days of undisturbed plaque accumulation and maturation. Signs and symptoms conform to the gingiva, confined to the gingiva. Presence of clinical signs of inflammation and no loss of attachment, and gingivitis is a reversible disease and reversibility of the lesion by removing the etiology. So to summarize, so we have gingivitis, which is an inflammation of gingiva, and the types of gingivitis, that is marginal based on etiology, plaque induced and non plaque induced gingivitis, and based on course and duration, It is been classified into acute, subacute, recurrent, and chronic gingivitis. And have anatomical considerations, parts involved, uh, the parts of gingiva which is involved. Based on it, it can be classified as marginal, papillary, and diffused gingivitis. And based on localization or the distribution of the disease, it is classified into localized and generalized. And coming to the features, we have a lot of microbiota which is involved in this particular thing, and it is a reversible disease. By treatment, the complete restoration of tissues can become normal. With that, I'll proceed with the next lecture. I'll be covering about the details about the color changes and its reasons, bleeding, why it occurs, and other components of factors altering the color, endogenous and exogenous materials which cause the color changes. All that will be discussed in the next lecture. Thank you.